You're listening to Happy Healthy Hormones with Dr. Chris. Are you tired of the short-term patch to your health problems? Is avoiding medications and surgeries important to you? If you answered yes, then your prayers have been answered. Dr. Chris has been helping people transform their health for over a decade. He's a world-renowned health expert who specializes in holistic health. He's a professional speaker, chiropractor, and international best-selling author. It's his mission to help you reach your full God-given potential through holistic health and healing. Get ready to be inspired and transformed. Here's your host, Dr. Chris.
Hello, everyone. This is the show where disease takes a dive and people come to thrive. I want to talk to you today about arthritis. It affects a lot of people. This is not just the old person's disease, right? This is affecting children now. And there are 50 million Americans that have arthritis. Over 50% of adults are told that they have it. And the CDC reports that by 2030, it will be 67 million people with arthritis. So where does it come from? What is the cause? What is affecting so many people to create this just debilitating disease that seems to almost come from nowhere? Well, anything that ends with itis, is an inflammatory condition. So there are lots of different diseases that we can diagnose and give you a medication for, but at the end of the day, it's still just the same simple thing, which means your body in that area or that organ is inflamed. Bursitis, it's the bursa that's inflamed. Appendicitis, it's the appendix that's inflamed, right? Hepatitis, it's the liver, right? I mean, the liver, again, it's just all a way to get more medications in us. But let's really get to the cause, right? Who's sick of just taking the medication? Do you want to take the medication for the rest of your life and significantly lower the quality of your life as well as the life expectancy of yourself? Or would you rather put in a little bit of work now and have an amazing life later, right? It's a pretty simple answer to many of you listening, but to some, it's a really big struggle. But it's really just another way to say you have dis-ease in your body. So let's really look at this. Where is this really coming from? What is going on? It affects a lot of areas of the body. Most commonly, you think of arthritis affecting the hands, but it can affect the neck, the back, the knees, and it's not just physically a problem, but also emotionally. When you have to start limiting what you're able to do, simple tasks like being able to open up a jar, button your own clothes, it really starts to challenge people in their own thinking about what else is going to be taken from them. How effective are they? Are they useful anymore? And the answer is yes. Yes, you are, but the fact is, we don't want to see you get there, right? We want to see you live a life of abundance. So let's hope you understand this, because a lot of people go years and years with this developing in their body and it goes undiagnosed. Oftentimes, it just starts out as a little bit of soreness in the morning, but just left, it continues to grow and get worse. And that arthritis, that inflammation, turns into bone spurs and turns into degeneration. And literally, your body starts to deteriorate and rot away as your mind stays strong. Now, I want to give you one myth and destroy this, that arthritis just happens with age. No, that's wrong. It might be common, but it is not normal for our bodies to develop these vast amounts of arthritis. There's a little bit of normal aging, sure, but I have seen patients in my office that are in their 90s that have no signs of arthritis in their spine at all. But these are the people that haven't had a bad lifestyle either. They haven't been exposed to certain chemicals or been in accidents and other things. So it doesn't have to be you. You can start to get control over this and start to live a better life. So what the biggest problem is that I see is the lack of motion in people, not getting up and moving. So a lack of motion in a joint creates arthritis in just 1 week. So if you slip and fall, hurt your hip, it hurts your knee, and you feel like you can't move that good, and you go on for a week or two like that, it's already starting to develop arthritis. So the faster you can get movement in those joints, the better. That's why when people get in things like accidents, car accidents, slips and falls, that I recommend they go in and get adjusted by a chiropractor as soon as they can so they can actually get movement back in that joint. It'll drastically increase their ability to keep off arthritis, but also drastically increase their rate of healing and repair too. Now, surgeries will cause a lot of arthritis. Anything you do to inflict injury on the body will start to develop that arthritis and that scar tissue. That's why most back surgeries, and depending on who you ask, it's anywhere from 90 to 80% end up the same or worse within 5 years. Them aren't very good odds, right? So we want to help you avoid the surgery for as long as possible, if ever having to go through with a surgery. Now, here's the thing. There are a lot of people that take medications for their arthritis, from their RA to different forms of arthritis and rheumatoid, arthritic conditions. But these medications lower your immune system. And one of the number one side effects of these medications for arthritis is cancer. Because your body can't kill the cancer cells when the immune system is weakened. So let's say you had to choose between one or the other. What do you want, arthritis or cancer? I don't want either one, but there's some things we got to do to start to make sure that you can have the success and increase your odds of either overcoming those things or never getting them in the first place. So there really is a difference between cure versus symptom relief. So relief comes from things like cortisone shots, medications, NSAIDs, your ibuprofen, Tylenol, aspirin, those things, massage, acupuncture, various supplements, even like turmeric or omegas. Those are things that help relieve the symptoms. But we really want to look at getting some cures to this problem. So how do you do that? You've got to get things out of your body that create inflammation. So start to get the inflammation down in your body, keep movement in your joints. So how are some of the ways that we can do that? One of the ways, foods. What do we put in? What do we keep out? So you should definitely be putting in good fats into your body. Those good fats are going to start to lubricate those joints. Most importantly, they're going to give your cells the building blocks they need to lower inflammation and to turn on the DNA in your cells that are going to promote health and not promote disease. Because what happens with arthritis, it really starts to just attack your own body. Your cells are attacking themselves, trying to help you, but it's not a very efficient way of doing that. So get in lots of greens as well. Anything that's green, get it in your mouth, right? As long as it came from the earth. Now, I'm not talking about those green Jolly Ranchers. I'm talking about the real greens, all right? And then turmeric, right? You always hear me talk about that in the omegas. The reason that's so important, there's so much research behind that. In fact, the Journal of Osteoarthritis and Cartilage showed that by taking turmeric and omegas in the right levels, and this is levels, if you're curious, around 2,000 to 2,500 milligrams of each of those, prevent and reverse the arthritis and the inflammation. So, yeah, it can be done. You just got to be consistent, right? Now, you can test to see whether you have the right amount of fats in your body, the right fatty acid, amino acids, the blood ratios, all that kind of thing, from the EPA, the DHEA, the 3, 6, and 9s. But don't look at those tests and be like, oh my gosh, my cholesterol and triglycerides are off. Remember, we want to have good levels of cholesterol. We want to even be maybe a little on the high side. But you'll never hear anyone say that in your standard doctor's office, because they can't give you medication if you're doing those things. So that's what we want to get in. But what do we want to get out? Well, we want to get out the sugars, the grains, even the dairy, and even nightshades. So again, I'm not saying this is for everyone, but if you have arthritis and you're struggling with that, you've got to eliminate these things to start to get that inflammation under control. And maybe at some point you can start to reintroduce some of these things, but you've got to start to get that inflammation down. So again, the grains, the dairy, the nightshades. So nightshades are things like peppers, potatoes, tomatoes, even eggplant. And there's some other nightshades out there. Those are like the major offenders there. And this is tough because I really love all those things, and I still eat those, but I don't have those inflammatory responses, right? And some people do, some people don't. So sometimes you can test for them, but the most accurate and the easiest way I found is just to start to eliminate them from your diet and get that inflammation down, drive it down. Now, the other thing we want to look at too is toxicity. So you really got to detox your body. In fact, there's one patient that came in a few months back, Marilyn. She was extremely toxic. She was having all kinds of arthritic problems and different joints throughout her body. And so we discovered doing some testing that she was actually very toxic. Different toxins in her body. We went through a protocol over a few months to get those toxins out, did some chelation with her. And at the end of that, we just reassessed everything to the testing. And man, she was not only feeling so much better, her pain had decreased, she was feeling better, her memory started to come back, her brain fog went away, and even her eyesight started to get better where she was not able to drive at night at all, and she was now able to drive at night with no problem at all. And obviously her arthritis was non-existent. So it wasn't because she had RA, it was because her body was inflamed. So really, you make the choice. Do you want to do some of these things to get that inflammation down and get your body healing and live on that cruise ship and vacation on those islands? Or do you want to end up in the nursing home? It's your choice. I'm telling you that right now. And then we get into the physical aspect of things as well. This is really key. So exercise, it decreases pain, inflammation, starts to slow down that inflammatory response, and ramps up everything else. So yoga, swimming can be great. Just try to get functional training, functional movements you're going to do on a daily basis. Those are great as well. And then also, I love chiropractic, looking for corrective chiropractic. So taking x-rays, seeing what joints are moving, which joints aren't, where they're stuck, where they're not, and then using rehab exercises in conjunction with different adjustment techniques, you can actually get the movement back in those joints, start to get the inflammation and pain down, avoid the bone spurs, the degeneration, and all those things that come along with that, and actually just start to create health once again in your body. And, you know, this always comes back to this one story that I think of with this patient named Kathy who came into my office with trigger thumb. She thought she had this severe arthritis. Doctors had told her she had arthritis. They were giving her all these medications. They were going to do surgery on this trigger thumb. I mean, her fingers couldn't move. We started to go through care with her, started to apply from chiropractic to some lifestyle changes, and the thumb pain went away. Movement came back. She lost 20 pounds. And, oh, yeah, she had all these GI problems. Those things all went away. But it was just doing the right thing. She was removing some of the key interferences in her life, and the body healed. The body will always heal. Just remove the interference, especially if you're the interference, right? We're guilty of it. Hey, I appreciate you guys. We'll see you next time. Remember, your body needs no help healing, just no interference.
Thanks for listening, and we hope you enjoyed today's episode. Please help more people in reaching their fullest potential and rate, review, and subscribe to this podcast. For show notes and other free resources we mentioned today, go to newedgewellness.com.